My name is Christopher Kroll. I am the school health liaison for Pima County's health department. Um, so our agenda is, oh, I apologize. So our agenda is we have a few announcements. We're going to go over our respiratory disease updates, which includes COVID-19, the flu, RSV. We'll have our epidemiology team as well give a vaccine update. We'll hear from our vaccine equity program, and then we also have a guest from the Arizona Department of Health Services talking about the sensory screening program. So a couple of quick announcements. If you have not seen it, we were able to launch our biweekly youth and school community newsletter. So just a little bit about that. We are able to have the recording of these meetings be on those newsletter, as well as resources such as oral health, vaccines, anything that you can think of, uh, in all in one place to just kind of keep you up to date. um, and then another thing too is that we have our Pima County Schools page that's updated. So you can actually click on the link on the screen and it'll actually take you to our website that has what diseases are needed to be reported, as well as like our updated guidance and other resources as well. So next, we're going to hear from our epidemiology team. Eliana, are you going to be presenting?
Yes, I'm here. Hi, Christopher.
Great. Just tell me whenever you want to hit the next slide.
All right, sounds great. Thank you so much. Um, Good morning, everybody. Thank you, Christopher, for introductions. And it's 1 p.m., so good afternoon, everybody. I'll correct that. Um, we'll just do a quick respiratory update with emphasis on COVID-19, RSV, and influenza for our school partners here. Um, First of all, small caveat, we are in the process of working with our informatics team to fill the gap of having some of this information I'll be presenting on better condensed in our website. We have gone through a process of website update, and by website update, I mean our Pima County Health Department website. Um, and so some links you might see are not working, but I always try to quote on the slides where the information comes from, etc. But hopefully by next call, I'll have some more graphs to share that come from our Pima County Health Department website. With that said, for COVID-19, since public health emergency ending back in May, the main metric that we utilize here in Pima County, and as per the CDC guideline to trend and monitor COVID-19 is COVID-19 hospital admission levels. And we are currently in the green. This data was pulled um, 8:30, but I checked this morning and we continue to be in the green. There is other counties that you can see in mostly eastern part of the country that are having some yellow, red, medium, higher transmission or hospital admission levels. Not the case for the data that we're currently monitoring at this time. And basically, what this means is under 10 cases per 100,000. Um, I'm sorry, under 10 hospital admissions per 100,000 total admissions, as the rate for our county is considered green low. And for us, it has been an average around 1 case per 100,000 population. So that hasn't changed in the last few months. On the right part of the slide comes also from CDC website, and it matches our current isolation and exposure recommendations for COVID-19 recommendations. Next. This graph here comes from ADHS. Once again, hopefully we'll have something a little bit nicer by next call. But cases have remained fairly low throughout the summer. This is with a huge caveat that cases have been harder to track ever since at-home testing has been available. So for several months now, this is not the full picture, but that's why we utilize the COVID-19 hospital admissions. Nevertheless, we have had a decrease in cases towards the end of August from Lab Reportable that we can see. Next, please. To touch on another one of our morbidities that I mentioned in the beginning, just a little bit on influenza. Our 2022-2023 season currently has 3,975 cases so far, which is about 1.4, 1.5 times higher compared to the 5-year average. About 26% of cases are between 5 and 18 years old, and this is technically or usually the group that accounts for second most flu cases in Pima County. For the most recent week that we have for a data for, which is week 33, we only had 11 cases, and this is slightly higher compared to 5-year average, which was 2 cases. However, this was a decrease from the previous MMWR week. As you can see, I don't know if you guys can see my cursor, but there is a very pronounced peak in the beginning of our epi curve towards the left side of the slide, where towards the end, if you look into the months of June, July, and August. So it has been a decrease, a constant decrease. And the majority of our typing is type A. Next, please. And then as far as RSV, we also continue to be in the very end of the 2022-2023 season. The next season won't begin until right around October. And we have seen an uptick in RSV cases for the entire season, around 3 times higher compared to last 5 years. However, that was, as you can see on the graph, which we also call an epi curve, the very beginning of the season. So the months of October, November, and not we're at the tail end, which is not as high at this time. 31% of these cases are for infants between 1 and 4 years old, and this typically accounts for the second largest group of RSV cases in Pima County. And for that same MMWR week that I was mentioning, week 33, we actually did not have any cases reported. And this was lower compared to the 5-year average. And it was a decrease from the week before. We'll see what the rest of our season brings us. However, new metrics I will try to share with you. CDC is working on a respiratory viral index. I'm not sure if it will have county level data, but that will be another kind of thing in our toolbox that we can share with schools for further prevention of respiratory illness transmission. Next, please. Resources continue to be mainly around COVID-19. But with the caveat that they do help prevent all respiratory illnesses, as it is also explained on the respiratory disease guidance that we released in the beginning of the school year. But I'll leave those links here. Next, please. As always, our slide here for contacting Pima County Health Department Epidemiology. If you guys have any questions, please email, please phone call. Sometimes we might request a record or something like that. There's our fax line. And we have also made a point to include our outbreak reporting portal for reporting of COVID-19 cases and potential outbreaks. We've noticed that maybe that hasn't been so forward in our website. It might be due to some cases, but generally, if you call us with potential COVID-19 outbreaks. This will be one of the first steps we lead to, just to make sure that we have a minimum amount of information. So we always appreciate when schools make use of that resource. We check it daily. Somebody from our team checks it every morning, Monday through Friday, to make sure we're responding promptly. Next, please. And with that, unless there's any questions, I can always take them at the end, but if not, I'll pass it on to Crystal.
Thank you. Hi, everybody. My name is Crystal Rambo. I'm the Immunization Program Manager with the Health Department. And I just wanted to give you some updates about some new products and some changes that we're going to be seeing soon in the vaccine program. So you can move forward to the slide. So there are some changes coming up for the COVID program in general. Now that the pandemic has been declared over, the vaccines will be shifting to a traditional commercial market. So that means that pricing and distribution will become more similar to what we see with our other vaccinations. So there will not be free vaccine distributed to all providers. So what that generally means is that your insurance will be charged if you have private insurance, and we are still going to be getting some doses to provide to people who do not have insurance, and that is expected to continue to a certain extent, so that there should be allowances to make sure that everybody can get no-cost vaccine if they do not have insurance. So that probably won't have a huge impact for the consumer, but just something to be aware of. So the bigger change on the consumer end is that there's going to be an updated vaccine that we're expecting soon. So that should be in distribution probably in the next few weeks. We don't have a specific timeline, however. So we will know more about the recommendations for that after the CDC meets on the 12th and votes on how they want to handle all the administration and recommendations. So that vaccine has been formulated specifically to cover the strains that they think will be most prevalent in the fall. So we're looking forward to that and are expecting good protection from COVID in the fall for that one. You can advance. So then the other thing I wanted to talk about is the upcoming RSV products. Some of these are already out on the market. Some of them are more coming down the pipeline. So there's Arexvy and Abrysvo. Those are both RSV vaccines. So those are recommended for certain adults who are over the age of 60. So it is a recommendation that is for people who have certain types of immunocompromise or certain types of underlying health conditions. So people should go to their doctors to discuss whether or not they're eligible. It's a protein-based subunit vaccine. The only reason I bring that up is to just talk about the fact that previously kind of technological platforms for vaccines were not really a point of discussion, but after COVID, that now is something that's discussed. So just know that this is an older, more traditional technology that was used to develop this vaccine. The efficacy is estimated to be greater than 80% for the first season after vaccination, and it is a single dose for now that will be given at the beginning of RSV season. That may change eventually into a seasonal dosing, but right now we don't know. Arexvy was also, this just happened pretty recently, so it's not even on this slide, was approved for administration to pregnant women when they're between 32 and 36 weeks gestation to help protect their infants against RSV in the first few months of their life, but that has not been voted on by the CDC, so more information about that to come. Beyfortus is not a vaccine, it's a monoclonal antibody product, but it's going to be used much like a vaccine. And that one is for infants up to 8 months old and some infants up to 18 months old, given annually to protect them from RSV. So that one is estimated to have an efficacy between 70 and 75%. And so these products combined are really intended to help protect our older adults and our infants who are really the most vulnerable to severe infection against RSV. Next slide. And then just a plug for flu season. Flu season is here. Flu shots are pretty widely available at this point, especially in commercial pharmacies. They're recommended for everyone 6 months and older. They are the best and safest protection from flu, and especially at preventing serious side effects from the flu, such as hospitalization and death. People over 65 now have a specific recommendation to get one of the either a high dose or adjuvanted flu vaccines, so just bear that in mind. Another change this season is that egg allergies are no longer a concern for flu vaccination. So if you previously had an egg allergy or knew somebody who had that concern and had to seek out one of the less easily obtained egg-free flu shots, you no longer have to do that. You can get any of the presentations, which is great. And I think that is my final slide. If you want to advance, yeah. So if anybody has any questions, you can reach out to me. I will put my email in the chat, but other than that, that's end of report for me.
Thanks so much, Crystal. Next, we're going to hear from our vaccine equity team.
Good afternoon, everyone. My name is Nidhi Jain. I'm the program manager for the Vaccine Equity Program. We are a team that has, it's a multidisciplinary team. We have health educators, public health nurses, health navigators, community health workers on the team. Also listed are my two program coordinators who really assist us with the vaccination events that I'm going to talk about. We have been in operation since January of 2022 and have hosted about 500 mobile community COVID-19 education and vaccination clinics. And many of them were youth and children focused. We've also supported TUSD schools with the clinics and were actively involved in the many of the back to school vaccinations with our clinics. And I want to just say that, we greatly appreciate the opportunity to coordinate these events for the students and the staff. So please do consider us. Next slide, Christopher, please. So the primary goal of the program is to improve access to COVID-19 vaccines and related education all across Pima County. As I have indicated that, we come to you, and I know there has been some changes, as Crystal mentioned, with the commercialization of the vaccine, but we will attempt to vaccinate, everyone to the best of our abilities and be able to provide free vaccines, as much as we can. Next slide, please. So what the one thing that we can offer through our programs, in addition to COVID-19 vaccines, are the health education print materials. So if there is anything that you would like to see, any kind of concerns that you see, any kind of information that you think that would be helpful for the school community, you could reach out to us and we could create a health education doc for that. We also have a health educator on the team, so we do health education presentations. We currently have a nutrition presentation, a wellness presentation, COVID-19, but we could also create more presentations if you do identify a need for a certain kind of presentation that we could deliver to the students or the staff. We could work with you on tailoring the presentation and having it delivered. And another service that I would like to mention is health navigation. So we have health navigators on the team. There is a Pima County website has health services request form that talks about different programs that Pima County has as the health department and also as the county, and then other programs that the county doesn't have. But so we might be able to work with you to look up resources. The way you could reach out to us is on the website, via email, and there's a number listed on there for the health navigation referral resources, and somebody from our team would be able to talk more with you and to find out what resources you're looking for, and they can do some research and get you that information. Next slide, please. So the email that you can utilize to reach out to us, whether it's for vaccination or health education clinic, or for presentations or any kind of resources, is myhealth@pima.gov. And we have a health navigator who's routinely monitoring it. We have, in fact, a team of, our many people from our team that do routinely monitor that email address. I have also, I also have access to it. So if you please reach out to us if there is something we can do to help, whether it's health education, whether it's promotion, or whether it's a vaccination clinic. Thank you.
Thank you so much. Next we have, next we have Morgan from the Arizona Department of Health Services going to talk to us about the sensory screening program. Sorry about that.
No worries. Hi, everybody. I am so glad to join you today. I apologize for my voice. We have COVID at my house right now, which is made for a really unfortunate long weekend. But I'm happy to join you to talk about sensory screening in schools, hearing and vision. I know a lot of people have a lot of questions, and hopefully we'll cover the most prominent questions that have come up, but please feel free to add additional questions into the chat. I will go to our next slide. I'm just going to do a quick introduction of myself. I've been in this role as a sensory screening program manager not quite a year. I came to ADHS as from actually ASDB. I have a sick toddler home with me today too, so he's going to jump up and join us for our meeting for a moment. But my background is in deaf education and working in early childhood specifically. I actually live in Oracle, so I am not too far. I drive into Phoenix once a week, so I take care of things all across the state, and I have a really big focus on more rural areas. So that's one of the things we're trying to really create some equity around as we move forward with policy changes and things. Next slide. So a quick overview of how this program is housed. Some of you are super familiar with it. Some of you may not know at all what the structure of our program looks like. We are in the Department of Health Services, in the Bureau of Women's and Children's Health, in the Office of Children's Health. And that's where you'll find the sensory screening program. The sensory screening program itself is me. I am the only staff member of the program at present, so I appreciate all of your patience in response to correspondence. Next slide. The two primary responsibilities of the sensory screening program are to make sure that schools have the resources to provide hearing and vision screenings in line with statute, and to make sure that those screenings are being administered in a high quality way with fidelity across the state. So the statute here, both hearing and vision are included in here, ARS 36-899 through 36-899.10. It requires all schools in Arizona to perform hearing screenings and vision screenings for all, but private schools are exempt from vision screenings in the statute. And it says that the Department of Health Services needs to develop administrative rules that guide how those screenings are done. That rulemaking process is outlined by the governor's office through the Governor's Regulatory Review Council, and it is a very detailed multi-step process that involves a lot of input from content area experts, stakeholders such as yourselves, public comment periods. Thank you to all of you who participate in those. We really appreciate the feedback that we receive when we have those roles open for public comment. It really helps us to make decisions in line with what is realistic on the front lines down in schools. Next slide. So those rules themselves outline who we're screening, how we're screening, what the setup for that looks like, how we're contacting parents, what the equipment is that we're using. This is where we get into the really hyper-specific details of what those screenings actually look like. The hearing screening rules have been in place for a really long time. They've been in place since the 70s. Every 5 years, rules are able to be opened up for review and edit, and we are currently in that position with hearing rules. So they are currently undergoing edits. We're primarily seeking to clarify a lot of the language in the hearing rules. There are a few things that are no longer relevant to how, like, procedural things that just need to be changed. Processes haven't worked that way in a few years. They don't need to be in rules. Vision rules, this is a big question, are still in draft. They've been in draft for going on 4 years now. We're very optimistic about this round that we'll actually get them finalized and adopted. But because there are not currently vision rules in place, these specific guidelines don't exist for vision yet. So we don't have specific criteria for the screening populations, the types of screenings that have to be done, the trainer qualifications, the screener qualifications. Those do exist currently for hearing, but not for vision yet. Next slide. The next big question that we're getting a lot of the time right now is, what is going on with training? We, earlier this year, were able to put a contract in place to restructure how the training program is being operated and presented to the public. Our goal was to make the program free to everybody in the state, which it was not previously. And we are also working to make virtual training options accessible as well. Because of this switch, all training is now being provided through the contractor that we work through, which is AZAP. I've got a slide on that next, but all training is going through the ADHS and our contractor rather than independent trainers. So most schools have noticed that if they've used independent trainers in years past, those individuals are no longer able to train and offer ADHS certification. And that is so that we have more control over the fidelity of the training across the state and can make sure that it's accessible and equivalent for everybody. Next slide. So again, why are we making all of these changes? We got a lot of feedback over the last few years that it was difficult to access training, that it was becoming increasingly expensive and burdensome due to the high rates of turnover for health office staff. And because the rules that were adopted by the ADHS outlined that this screener certification was a requirement, we really felt like the responsibility then should be on the department to make that training and that certification accessible, rather than having that burden be on schools, which is where it has been for a number of years. And so that has been the primary impetus for all of the changes that we're working to implement. Next slide. Hopefully by now, if you are familiar at all with our training, you know that our contractor is the Arizona chapter of the American Academy of Pediatrics. They don't operate in a vacuum. We work hand in hand together at the department. I meet with them every week to make sure that we are on the same page and moving forward the way that we need to be, and everything is in line with legislation and rules. Next slide. All right, scheduling training. There's been a lot of changes in how we're scheduling training, how we're offering training as the months have gone by, just due to demand and the resources that we've been able to build out and make available to the public. So right now, we have a fully online lecture and quiz portion of our training, which is working out really beautifully for most programs. It's an asynchronous pre-recorded lecture. Staff can log on to our training site, complete the course on their own time. They'll then complete the quiz, and they will be given an invitation after they complete the quiz to sign up for the final component, which is an in-person equipment competency. We have some pre-scheduled dates that are they're in Phoenix right now, but we can schedule ahead of time as for your group, a pre-scheduled date for the in-person competency for all of your school's staff, for your district staff, for an area. Outside of the Phoenix area, we're really scheduling those on an as-needed basis. But the primary training is being offered virtually and self-paced. For vision right now, like I mentioned, we don't have vision rules, so there's no requirement that vision certification be held, and there's not, we haven't finalized, because the rules aren't finalized, what has to be in the curriculum, what those training requirements are. Also, we're not finalized, so we aren't currently offering vision training. The biggest, most important piece I've said a few times is no one should be being charged for training. It should all be being received for free. If you access a training that says that it's ADHS certified and you're having to pay for it, it's not, please call me. But right now, in order to register for the training, my website just says to email the sensory screening program. So please go ahead and do that. And I can send out the link to access the hearing screening training course directly. Next slide. The other opportunity that we're really excited about right now is that we are working to increase the capacity of schools and districts to train their own staff. We are really hoping to broaden our reach for the training with additional trainers. So the rules outline very specific criteria for what you need to meet as far as educational background and screening experience to be a trainer. And if districts or schools have an individual who meets that criteria and is interested, we will provide trainer training. We have built out every tool that they'll need to provide training, and they can either utilize the pre-recorded online session, and their responsibility then would only be that hands-on competency component, which they could coordinate for, again, a group or on an individual basis for your program employees only. We would not be asking that they train outside of your school or district, whatever that agreed upon group is. However, we also have the slides, a trainer manual that has the entire script. So if people did want to present the entirety of the training live, they would also be able to do that and have all of those resources and the support. We are not compelling anyone into doing this. It's just a request. If people are interested, available, willing to provide these trainings as part of their regular responsibilities for, just new staff that come into the school, so that those 1 or 2 people every year can get trained quickly and we minimize the downtime for your programs. Next slide. This slide is just a quick glance of what those requirements are to be a trainer in the rules. So a school-based audiologist who's been doing some screenings, or you don't have to be a school-based audiologist, but if you're a school employee. A current hearing screener. This is one that is where we're catching a lot of our eligible trainers who didn't know they could be trainers previously. If you've been a screener and had certification for 5 years and you've done 3,000 screenings in that time, then you are eligible to become a trainer. If you have a college or university background in audiology or speech pathology, or if you are working as an audiology or speech pathology aide, and have the requisite number of hearing screenings under your belt as well. Next slide. I think it's just my last one. So if anybody is interested, if you have questions, if you want to access the training information, if you want information about becoming a trainer, all of those questions can come to me here at Sensory Program, or this is the Sensory phone number. Like I mentioned, I am the Sensory Program, so all of those emails come directly to me, and I appreciate your patience as I work to respond to everybody. And that is all from me.
Thank you so much. And of course, as always, the school's support team, this is our information. If you have any questions, comments, or concerns, please reach out to us either via phone or via email, and we will get back to you. And with that being said, does anyone have any questions? You can put those in the chat. And also just for clarification too, we will be sending these slides out in our next newsletter. Yes, thank you for everyone who did present today. We really do appreciate all of you and all the work you do. Okay, with that, if there are no questions, I'm going to go ahead and end the call. Thank you all so much for joining. Please look out for our newsletter. And yeah, have a wonderful evening.